Welcome, everyone. This is Liza Greenberg. I'm a consultant with the Patient-Centered Primary Care Collaborative Support and Alignment Network, and we'd like to welcome everyone to our Pediatric Learning Network. We are discussing adopting person and family engagement strategies to improve pediatric asthma care. And as those of you who have been with us know, this has been a 5-part series on person and family engagement strategies, working to reduce emergency department admissions through improved quality of care and person and family engagement approaches specifically. Today, call number 5, we have our quality improvement leader, Ruth Gabernick. We also have a practice innovator, Nora Birchie, and myself, our facilitator, Liza Greenberg. And I'll just run over the goals one more time. As you know, we have been working towards collaborative approaches for using person and family engagement, helping practices in the Transforming Clinical Practice initiative to identify community partners who can help engage patients with asthma, and discussing coordination and communication around family supports and services in the community. At the end of the webinar, we'll wrap up and review the strategies we've addressed throughout our 5-call series and talk about next steps for quality improvement. So I think we've already talked about this. Today we're doing our webinar on connecting patients and families with supports and services. And just a reminder, we've been aligning our Learning Network series with the Transforming Clinical Practice Initiative Person and Family Engagement Performance Metrics. And today's metrics will be focusing on using e-tools and connectivity, and we've addressed many of these other metrics throughout our other webinars in this series. And also, this should be familiar to you, our design or schematic showing how quality improvement for asthma is very closely aligned with person and family engagement strategies. So PFE is not a separate activity that clinicians are asked to do to improve quality care, but rather embedded in your quality improvement strategies. So as you're working towards asthma improvement, you've got each of the metrics have an important role in helping to drive that quality. So using family voices, addressing health literacy, activating patients, et cetera. So that's kind of the framework we've been using for these calls. And with that, I'll hand it over to Ruth. Thank you, Ruth.
Great, thanks, Liza. Welcome everybody to our 5th webinar. Just wanted to put this up there once again, that, just a reminder that patients and families need to be actively engaged at all levels of healthcare, including pediatric primary care. And there needs to be a free flow of information to and from the family, the patient and the family, in an environment where the patients and families are always treated with respect. Next slide, please. So I'm really happy that this month we have a collaborative practice innovator, Nora Birchie, who's going to share with us a very innovative program that's going on in Cincinnati with lots of partners. So Nora, it's all yours.
Good afternoon. I was delighted to be asked by Ruth to participate in this. I wanted to share my delight in the webinar because it's just right up our alley. But I wanted to tell you about Cincinnati. We are a river city located in the southwest corner of Ohio. We border Indiana and Kentucky, and because we're in a river valley, we have an increased number of allergies and children with asthma. Since 1826, the Cincinnati Health Department has been committed to protecting and improving the health of the people of Cincinnati. As a nationally recognized leader in public health, the Cincinnati Health Department advocates for responsive health and human services that promote healthy living environments and social well-being, as well as works to reduce health inequities such as poverty, such as poverty and unemployment. The Cincinnati Health Department is unique in many ways. Many health departments do not offer primary care. We have a Federally Qualified Health Center qualification, FQHC status, which serves because of the care we provide to over 40,000 patients annually. Our health department operates 7 primary care health centers, 4 with dental clinics, 2 freestanding dental centers, 1 freestanding vision and dental center, and 13 school-based health centers. For those of you who might not be familiar, school-based health centers are full-service health department clinics located in schools, and we are a partner with Cincinnati Public Schools. Our clinics serve the medical needs of children and families in the school and community, and currently there are 13 school-based health centers serving over 10,000 students. The clinics provide physicals, asthma management, immunizations, prescription medications, sick and injury care, and health education to children and families. Having a clinic in the school makes it easier for parents to keep up with their children's medical needs and keep children in school. School-based health centers create better access to health care and help keep families healthy. We have been a partner with Xavier University on a HRSA grant since 2015. The purpose of the grant is to promote interprofessional collaborative practice. Our asthma project is the largest multi-site endeavor that we have done yet, and this is utilizing this grant opportunity to its maximum. This will be our grand finale to our learning with our interprofessional collaborative teams. Our goal has been to find doable ways to support the quadruple aim, utilizing an interprofessional collaborative team. The grant speaks to the triple aim, which has evolved now to become the quadruple aim, which is improved family, patient experience and satisfaction, improved health outcomes, reduced health care costs, improved provider satisfaction and joy. The theme that has emerged from all of our projects is supporting patient self-management, whether it is in an IPCP team working with uncontrolled diabetics, Latino families with overweight children, chronically absent students, or to students now with asthma. Hence our interest in CHAMPS. So that slide is up right now for you. CHAMPS stands for Community Health Care for Asthma Management and Prevention of Symptoms, which is a family-centered, patient-tailored, evidence-based pediatric asthma intervention. The CHAMPS intervention combines asthma counseling and in-home mitigation of environmental triggers for children with poorly controlled or moderate to severe asthma in primary care settings. The CHAMPS intervention began as a research study conducted in 3 federally qualified health centers to assess whether evidence-based interventions for asthma could be successfully replicated in the health center setting. The CHAMPS intervention demonstrated marked improvement in the control of patients' asthma, an increase in patient and caregivers' awareness and understanding of asthma, and a reduction in asthma-related visits to urgent care and emergency departments, all things that piqued our interest in the program. The CHAMPS intervention is effective for and can be tailored to fit any practice or patient population where pediatric asthma is common. The CHAMPS intervention is based on the National Cooperative Inner-City Asthma Study and the Inner-City Asthma Study, which were funded by the National Institutes of Health to study pediatric asthma in the inner cities. Both studies demonstrated that providing patient-tailored behavioral and environmental interventions in high-risk inner-city populations can lead to improved asthma outcomes. The CHAMPS study took place through a multidisciplinary collaborative effort between a team of experts in the fields of asthma, child health, health policy, epidemiology, and health services. The CHAMPS study evaluated the clinical and cost effectiveness of an intensive evidence-based childhood asthma counseling and environmental intervention for pediatric asthma patients ages 5 to 12 with not well or poorly controlled moderate to severe persistent asthma. The intervention is both clinical and home-based. We thought this could be applicable to our situation, utilizing an interprofessional collaborative practice team to implement the CHAMPS strategies. We are anxious to maximize the assets available within our health department. We have a small but mighty home health department that has been underutilized in the area of asthma management. We employ sanitarians, expert in home inspections and mitigation, and we have pharmacist and health educator expertise in-house. This project is working to engage all these professionals in optimizing our asthma care. On the slide, you see a picture of a few of the people that are involved in this project. I'll go ahead with the next slide then. There's a busy diagram that is from the CHAMPS program, kind of an algorithm of how things are done. And we identified our population based on school health records. There are over 1,500 students in CPS schools at our 10 participating school-based health centers recorded as having asthma. They have classifications ranging from intermittent to severe persistent asthma. By our PowerSchool data, it's apparent that 40% are classified as intermittent asthma, 29% in the persistent range from mild to severe, and 31% are currently unclassified. We expect to see a shift in classification with implementation of spirometry as an additional tool in asthma assessment and management. It is most likely that more students will be classified in the persistent range, and this has been shown by many studies when spirometry is available and used. Prevalence rates vary between sites, which we hope to learn more and understand better if this is a true variance or due to record discrepancies. Our nurse practitioners, registered nurses, and medical assistants are currently participating in an online spirometry training program, Spirometry 360, from the University of Washington, to learn how to perform quality spirometry and interpret the results. The program also provides feedback on a completed spirometry report as an integral part of our learning. I am working with our home health department to assemble an asthma visit kit that will include the home environment risk assessment and CARET, child asthma risk assessment tool that are highlighted in the CHAMPS manual. One of our health educators on the team is also a sanitarian and will accompany the home health nurse for her first few visits until the nurse is comfortable with the environmental assessment. Our home health nurses will be able to make up to 4 visits to the home for an initial assessment and follow-up. And we anticipate that adding the home visit will be helpful in engaging families and providing vital information to our providers. Due to the size of our home health department, patients will be selected for a home health visit through a triage process based on asthma control status, their history of exacerbation, allergy test results, and finally an okay from the family to visit. As a side effect of this work, we may find evidence and support to adding additional home health nurses and community health workers. We have been working with our Cincinnati branch of the American Lung Association for educational materials. The ALA health educator provided our school nurses an asthma basics presentation in August to cover the most current asthma information. We are planning to utilize the ALA's open airway curriculum at our elementary sites and continue to look for the best options for an adolescent format. Perhaps using the ALA's Asthma 101 program will be our final decision. We are supportive of each site's unique staffing and population and their determination of what might work best for them. We hope to provide options and resources that could work in any situation. We have also formed a partnership with the regional representative from Thermo Fisher Scientific, the maker of equipment and assays for immunocap allergy testing. He is working with us to bring additional resources and support to the project. We are in pursuit of establishing connections with our Medicaid managed care organizations to see what support they might be able to offer us, especially for allergen reduction items such as pillow and mattress covers and HEPA filters. We are integrating elements of the original CHAMPS program with our current asthma care tools. In the CHAMPS program, they have a tool that's called the Asthma Symptoms and Utilization. And instead of using that, we're utilizing the ACT score, which has been used for many years for tracking asthma symptoms in our school population. We are keeping the CHAMPS forms for child-adolescent risk assessment tool, the CARET, and the home environment observation, adding a few additions that have been suggested by our sanitarian consultant. And those tools will be used by our home health nurse. And the last slide is, in essence, we're creating a hybrid program, recognizing our unique situation of primary care located in a school. We have opportunities that, because of our location, we can evaluate how asthma-friendly our schools actually are, potentially advocating for school-wide policy changes as revealed in our evaluation. We are considering looking closer at school and community air quality and making people aware of that, broadening education efforts to teachers and staff in the schools. Materials are plentiful for quick courses for them to increase their knowledge and comfort. We're also working in particular with physical education teachers and coaches to increase their knowledge and comfort in working with students with asthma. Some anticipated challenges are mainly one of the main drivers for me to engage in this webinar. We are diligently working on family engagement. We really understand and appreciate the need to increase family engagement to be successful in good control of our students with asthma. It happens to be an ongoing challenge in school health. We have what I call easy access to students, but we have great difficulty in contacting and connecting and engaging families. We deal with bad numbers, no numbers, and troubles locating families to even connect. Students are seen with written permission from their parent or guardian, but without the parent present for the visit. So our challenge is that connection with the families after the visit. I anticipate we'll have some problems because of this difficulty communicating with cultivating shared decision-making principles in preparing our plans and management of our patients. So we're especially looking at those areas. To highlight problems with communication, we're exploring best ways to contact students and families via calls. Text have been fairly successful. Written information sent home has a 50-50 chance of actually making it to who you want it to get to, and using an all of the above approach. We are working at improving our messaging with careful consideration of our populations to make it age appropriate, native language and literacy concerns addressed. Our students come from many countries. The most predominant native language is Spanish, with students from Guatemala, Mexico, and other Central American countries. We also have a growing number of students from Nepal and a variety of African countries. And we hope, of course, to incorporate best health literacy practices. I wanted to thank the PCPCC for this webinar. I've gained a lot of insight and also appreciate the outreach and interest in our program, especially the very helpful conversations that I've had with Ruth and emails with Liza. Our Asthma Champions team is eager to continue our learning and exploration. The end.
Well, thanks, Nora. That was really terrific. I appreciate the fact that the time you took to really share with all of us a great example of community-based collaboration, multi-professional, having all kinds of levels of work that you've been doing, and appreciate some of your honesty about some of the challenges and the strategies that you're hoping to be able to tests using, because I'm sure that they're ones that some of the other practice teams or facilitators on the call, are shaking their heads yes, that they're dealing with some of those same challenges. We wish you, lots of continued success. I know you've been planning hard, and as you roll it out, I hope you'll keep all of us in the loop to be able to hear what Cincinnati is up to, hopefully through publications that we can all access, and any resources that you develop that can be shared with the community through an organization like PCPCC, or just as even links to Cincinnati Health, that would be really terrific. So thank you so much. That was great.
Sure.
Really great.
You're welcome.
So now we have a question for all of you on the phone. One thing before, if you have any questions for Nora, just please enter them in the chat box and we'll try to get to them, or we'll definitely get back to you with answers. But here's a quick polling question. Who are you in your community? Who are you partnering with to connect and engage your parents with asthma, your patients with asthma and their families with support and services that they may need? If you could take a minute to answer this question, and then we'll see what the results are. Okay, so we see most of the connections have been with the specialists who are co-managing your patients. And good to see that the public health departments, like Nora just spoke about, or at least some of you are reaching out there. So it looks like there's especially some opportunities after we have our webinar today to think about how can you connect with the schools in your community and other community-based organizations that may be part of other initiatives that you may not even know about. So lots of opportunities for doing this. Next slide, please. Okay, so this is the what we're going to talk about today. For you all to think about, who are your neighbors? Who are your partners that you can engage with to be able to help further engage your patients and families who have asthma with being able to coordinate the support and the services that they need. You can see that there are lots of partners included in this diagram, and it really does take a village. We're going to talk about some of these in the next few minutes, so that if they're not folks that you've reached out to or even have a conversation with yet, that hopefully you will as you move forward with some of your practice transformation. On the next slide, think about, as a facilitator or as a practice team on the call, ask yourselves, how can we as a medical home for these patients with asthma, how can we facilitate increased partnership and communication across our medical neighborhood in order to help engage patients and families in their asthma care? And how do we facilitate seamless and timely transitions of care, whether it's between us and the specialists or the emergency departments, urgent care and other partners, schools, school-based health. So let's move forward with the next slide. And let's focus first, since many of you said that you are working with specialists in your community. I think we missed if you can go back one more slide. There we go. Okay, so the co-management with specialists. This is really an opportunity, if you're not doing this, to really enhance that communication. So it's on a routine basis that there's a two-way exchange of information between you and the specialists in your community who are seeing your kids with asthma. We've included in the webinar today some handouts you can download, examples of like a co-management agreement or between you and the specialist about what the expectations would be for information and communication, and also a new patient referral or consultation form that you may want to test using. Some practice teams doing this similar work to yours have actually invited in specialists from their community who are seeing their patients with asthma. It's really an opportunity in some cases for you to gain additional information about the guidelines or medical management, you know, from those specialists, but also it's really the chance to meet them, to share information, and these lunch and learns are for everybody, not just physician to physician, but to be able to include everyone, you know, from your front desk to your back door, and do, whether it's a brown bag lunch or you include, you spring for pizza. In this case, it could be a specialist, or there's certainly opportunities for each one of these partners that we're going to talk about for you to invite them in and build that relationship. There are opportunities to engage your patients and parents and caregivers as partners in this process as well. You can invite them to these discussions with and lunch and learns, and to be able to have them, you know, kind of they are working with you, and they're also working with the specialists, so they are definitely partners in this triad of sharing information and care management for their children. Next slide, please. So another partner, and certainly we've talked about this, you know, when the patients are seen in the emergency department, this is an opportunity for you to know your ED partners. I mean, we don't want, you know, our goal is to keep patients out of the ED, but sometimes that happens. So to be able to maybe have a meeting on site at the ED, establish a point of contact so that they know you and you know them, so that maybe it'll improve the flow of information back to your practice when one of your patients is seen in their emergency department. What kind of information can you make, you know, in engaging families, patients and families, if they're seen in the ED? Some practice teams make sure that it's easy for a family to carry with them their action plan. Information about your practice, to be able to say, if you're seeing my patient, please, here's my contact information. Make sure that I know about it in a timely fashion. And in return, you know, I mean, there's two-way communication. That way you can do that follow-up that you may need to do if a patient is seen in the ED or the emergency or the hospital. It allows you to close that loop, to really establish relationships so that it will help the families who you are taking care of. And as part of this, you know, each time, as we've said before, you know, to ask the families about what they think needs to happen, what happened in the ED that is an opportunity for improvement for them and for you. Next slide. So this partnership for school partnerships, Nora gave us a wonderful example of the school-based health and partners in the community working together to be able to develop those collaborative partnerships, which are just so key. And, you know, I appreciated the honesty that it's not easy, as you know, to get the voice of the patient or family at the table as you're doing these initiatives. But there are some opportunities over time to be able to help that happen. And we'll talk about, you know, we've talked about the voice at the table, and in a few slides we will talk about that some more. But there's a resource that I'm sharing with you today that is called Making the Grade. It's about working with families and schools. It's about more than just asthma care, but it's from the American Academy of Pediatric Council on School Health. And you may find that it gives you some good food for thought because those partnerships with schools are just so important. On the next slide, you know, again, talking about having open communications with the schools, the practices, the primary care practices, may want to be at the table when some of these, even on the phone, when some of these meetings go on between the families with children with asthma and the school nurse or other members of the school community. It really is a shared responsibility, and there's an opportunity for ongoing family participation in every level of the decision-making and the care plans, whether it's in conjunction with the primary care practice or the school partnerships, because we know how much time these kids are spending in school. Next slide. Another part of your medical community that is just so important, and we saw that, you know, from our quick poll, that it's an opportunity for improvement. You all have community partners out there, and again, I encourage you to invite them in, because, you know, some of your families who are struggling with their asthma care management, it may be because of other issues that they're dealing with. And as Nora mentioned, you know, to be able to have partners like housing or environmental health involved, because it may be some, to be able to do inspections and identify if there's a pest problem that could be a trigger for this child's asthma, or they, you know, utilities have been turned off that have an impact on the living environment. There are community health workers through community-based organizations, partnerships like CHAMPS and others, you know, in standalone or in conjunction with partners like the Public Health Department. I think that, you know, I challenge you, if you haven't yet invited in your local public health department to come and have lunch with you, and ask them whether you focus, you know, you say, you know, let's talk about asthma. I want to talk about our kids with asthma, or you want to know what other resources they can bring to information about, whether it's WIC or other programs that are available. That can just be such a wonderful resource to engage your families with services and support that they need. Next slide, please. So I hope you'll use this opportunity after our webinar to really talk among yourselves and to think about what are your current communication paths that you have to be able to improve asthma management. You know, who do you have those partnerships with? Is it just other specialists, or do we have a partnership with a community organization that we can replicate and use to engage others to be able to help support our families? Is there one that in particular that you as a team really want to focus on to improve, and you want to start there? So remember, this is quality improvement, so start small. Think about what works, what your priorities are, and which one of the partners that you want to engage in from your community would be the first one on your list that you want to invite in and improve communication and support for your families. Next slide, please. So I'd like to spend the next few minutes circling back and kind of wrapping up, because this is our 5th month of meeting together, and we've talked about a lot of, shared a lot of strategies and tools and resources. So I'd like to highlight a few of the ones that we have talked about and discussed and shared in the past few webinars that are focused on improving asthma care management in order to reduce ED visits by specifically engaging patients with asthma and their families. On the next slide, just a reminder that, you know, if you haven't yet created a registry to be able to identify who are your patients with asthma, that it's not too late. It's still important as a first step, and it really will be something that will help you sustain the improvements that you've been working on and to continue to engage your patients and your families. As we have talked about, it doesn't have to be, you know, a expensive piece of technology application to do this work. It can even be low tech using an Excel spreadsheet. But it is really important, if you're going to be able to engage families on an ongoing basis, to know who they are and to be able to track you know, the information about their asthma and about the outreach and follow-up that's going on a regular basis. Next slide, please. Early on, we talked about engaging patients and families in conversations related to their child's care. And specifically, one of our tools was the ACT, the Asthma Control Test, standardized tool to be used as a routine part of asthma care. I hope that this is something that some of you have had a chance to test using and have now incorporated. It was great to hear that this is a tool that the CHAMPS program in Cincinnati is going to continue to use, because they see the value of it. And again, we're doing quality improvement here, so these aren't just implementations. If ACT isn't part of your routine asthma care management yet, that tomorrow you can test it on the next patient who comes through your doors and get feedback from the patient and or family. Next slide. So we also talked about and discussed how to engage and partner with parents and caregivers in other ways besides their child's care, to have them as at the table as part of your practice QI team, to be able to not wait until after you've made changes to then just get their feedback, but really to have them participate in the planning and the testing of the work that you're doing for your transformation. One idea that another resource that was shared had to do with and is related to the voice at the table with the metric for engaging patients and families as part of this work that you're doing, and the formation of a patient and family advisory council. Nora, one suggestion that came to mind when you were speaking about how, the challenge of how do I engage the patients or families, the families of your patients. You may find as you're getting involved, especially with the adolescent patients with asthma. Other practices have told me that the adolescent patients aren't shy. They'll tell you what they need and how they, what would help them, and to be able to be successful in their care management. So you may want to focus your advisory council and including some adolescents as part of that group. Even at this point, to be able to, engage a few of them as partners as you're doing this work. And then in addition to that, just that solicitation at the end of every asthma care visit, asking for observations or just comments about the process of care delivery that the patient or family experienced today when they were with you. That's really valuable, as we've talked about. It doesn't have to be formal surveys. You can gain a lot by just asking some questions at the end of the visit. Next slide, please. So we've also talked at length about the use of teach-back strategy as an evidence-based health literacy intervention, and a way to really, it's a communication approach to be able to really be more successful with shared decision-making. And with the idea, as you remember, that this is about asking your patients or the family members to repeat in their own words what they need to do or what they need to know in a very non-shaming way. It's not a test for the patient or family. It's phrased or it's framed as you wanting to make sure that you've done a good job. explaining a concept or what the expectation is. And it's a chance to really check for understanding, and if necessary, to reteach information if you find that there are some gaps in the information that you thought you explained, but maybe there's a better way to say it or do it. On the next slide, again, talking about teach back, remember that this method is a way to ensure agreement and understanding about the care plan and about the essentials of being able to achieve that adherence. It's just one way there's one way to do this after explaining, it's one way to do this after explaining the strategy, where you just say, I want to make sure I explain this correctly. Could you tell me in your own words? As opposed to, do you understand? And just, do you have any questions? Or where I'm just going to answer no if you ask me that, and then come away and I may not have really understood what you told me. So this is, if again, don't feel that we've passed you by. You've missed the boat on this. If you haven't yet tested the use of the teach back strategy, try it with the next patient that you see and family for asthma care management. Next slide, please. We also talked about the use of a simple tool like this one to be able to measure patient activation, which is also one of the metrics for patient and family engagement for your transformation work. Here's one of the simple tools that was shared to be able to measure health confidence and health information. So again, I encourage you maybe download this, print it out, test it with the next patient that you see in your practice, and come together, use this as an opportunity and a tool and strategy to do some quality improvement work that can really, these small changes can make, as you know, huge differences in the quality and safety of the care for your patients. The next slide, another strategy that we talked about, I think maybe the second or third month of our webinars, had to do with medication management strategy. And so we discussed the need to employ a standardized, systematic method to evaluate and support patients and their caregivers in medication self-management. So consider adding, if you haven't already done that, a few standardized open-ended questions to your EMR or EHR template so that you can assess your patient or family's ability to self-manage the medications. It may be a question like, are there any barriers to getting your meds? Can you tell me what this medication what is this medication you or your child's taking? What are they taking it for? You may want to record document or record information about the teach back strategy that you used, or you may want to ask patients to make sure that they can list other medications that their child is taking. So again, maybe start with one question added to your template that will improve the medication management that you're doing as part of these routine asthma care visits. Next slide. We also had a discussion about, with Asthma Support, there are devices such as spacers and nebulizers and inhalers that and even epinephrine that are used by the patients and often not used correctly. So the opportunity at every visit to be able to make sure that this is to demonstrate or have the family demonstrate how this is being used. Remember, this is a team sport we're asking you to do. So I've had physicians who have said, I don't have time to do this. Well, that's totally understandable, but you have a whole team, you have staff, you have other members of your team who could be the ones to be doing this and having these conversations. And staff members who have been trained and given this role and responsibility have also reported improved job satisfaction because they feel that they have an important role to play to be able to help these families and engage these families to be able to manage their asthma better. Also, you have here's another opportunity to reach out to partner organizations in your community. Maybe there isn't a CHAMPS collaborative going on in your community, or something maybe on a smaller scale, but a partner who can be the one to do a home visit, or to be able to connect in some way with your family, your patient and family, to make sure that this part of the visit, this part of the information is happening as well. So, you know, there are lots of chances for everybody to engage the patient and family. Next slide. So another conversation, an important one, and an important tool that was shared, and a metric that you have as part of your patient and family engagement, is this being able to use shared decision making. And this slide just, you know, reminds you of one model. I like this because it's simple. The 5 steps, you know, if you remember share and what each of the letters stand for, it will help you make sure, make you aware and make sure that there's shared decision making going on, which is just so important to engage the patient and family in their care. Again, I can't emphasize enough that you can do this test doing this with, if you're not already, with the next patient and family that you see, and get their feedback about how it went for them and how they felt about the fact that you were engaging them and in the decision-making process. Next slide. Because this is especially important with asthma care, because the Asthma Action Plan is a perfect opportunity to be able to use that shared decision making. It can be created as a result of that shared decision making, because it has, you know, as you know, it provides the list of the daily and emergency medications and the triggers and the provider contact information. And it really is, it's helpful for the patient and families and the schools and the emergency department, anyone who's interacting with this patient. And it's also an opportunity to be used for asthma education on an ongoing basis. So using a strategy like shared decision making with the Asthma Action Plan, using teach back to make sure that the patient and family are clear on what you explained, allows you to put together each one of these individual tools and strategies that will help engage your patient and family. Next slide. Last month, we focused on the use of e-tools to increase engagement. And since our last webinar, I found a few more examples of patient portals. And I just wanted to share them with you. If you're in the process of either building or redesigning a patient portal for your practice, this was, I thought, you know, like a good example. It's clean, it has useful information with the highlights. It's really easy for the patient or family to point and click to be able to get to the information that they need, whether they're going to be a new enrollee or they are coming in, you know, to use the portal. I like the fact that it even gives you access to a user guide. And here's also, you know, if you're not already on our email list, here's your chance to do that too. So it's just kind of some food for thought about, you know, things that you may or may not be have as part of your patient portal website. Next slide. Here's another example. This example has some great information, but, you know, when I look at this with my aging eyes, the font would be better if it was larger for me. I love the fact that they incorporated a video into the web page about their patient portal, but unfortunately, when I clicked on this, it didn't work. So just to remind you how important it is to have some patients and families test your portal when you get it set up. Make sure that everything's working properly before you go live. And I liked at the bottom of this, it said that we welcome your feedback about the patient portal, and there's a place to click on it. So, again, use it as an opportunity to get feedback about what else patients and families may need. One last example on the next slide. Again, good information, clear, concise. So just some food for thought to kind of circle back to the discussion that we had last month. Next slide. You've seen this. This is the 5th time now part of this learning network series that this is quality improvement work that we're asking you to do, and the model for improvement is a great way to do it. So take the time to really go through the process, use a PDSA worksheet. You'll find that it will really, the documentation will help you be able to test very small tests of change in a rapid fashion to be able to see what works and what doesn't. You can learn a lot from the failure and how to make improvements. On the next slide, here's bringing you back to our overall goal of this learning network to reduce asthma-related ED utilization. So in terms of quality improvement, so important to be able to know your ED utilization rate for your organization, measure it, graphically display it, share it on a monthly basis. It will really it's a key piece of the work that you're doing. And here are a few examples of planned tests of changes. So, you don't have to reinvent the wheel. If one of these speaks to you, and because you say, we're finding our patients are going to the ED more often on Mondays or Fridays, and because we don't have enough sick visits in our schedule, maybe that's where you want to plan a test of change, or to be able to maybe have a schedule change for more practitioners on Friday afternoons to see patients who may need to be seen so that they don't end up in the ED over the weekend. Other things like having someone on call in your practice each day to make sure all the walk-ins are seen if you have walk-in capability, or to be able to evaluate and see whether or not and how you may be able to expand some evening or weekend hours if that's needed for your practice. And again, each one of these, do this with patients and families as part of your improvement process, and including, asking them to evaluate some of the things that you're doing. Maybe your after hours triage, is it working for them? You may do it in quick and dirty survey that you send out through your portal, or you may do it informally at the end of the, when you're returning calls for patients who have called in because of they after hours and participated in nurse triage. Next slide, please. So remember, this is all about working as a team, and there are many different members of the team, multidisciplinary, multi-professional, different levels. You can invite in these one or more community organizations to be part of your team as well. Next slide. And just some tips for sustaining the work that you're doing. You have been working hard on this transformation work to engage patients and families in their care, and to be able to keep moving forward in a way that the changes that you've made will be sustained. Here are things to remember. It's important. This isn't just a project that you're doing that's going to then go away. It's ongoing, information with keeping your leaders informed. These are systems changes so that it needs to be, it's not dependent on a person, but you have systems in place so that everybody, regardless of who's doing it, there's a standard of care, that you are adapting and creating new tools, and you're monitoring, when the metrics that you're doing as part of this transformation work, how can you continue to monitor those, maybe only quarterly or maybe every 6 months, beyond the life of the CMS initiative. Communicating, letting everybody know about the work that you're doing, and use your data. Next slide. Last polling question. As a result of your participation in this learning network, we would love to know, how confident do you feel about being able to keep your patients with asthma out of the emergency department? Okay, you can see the results. Great. Oh, thank you. Okay, so very confident, somewhat confident. Great. Very, we're happy to see that. And no change would have made me feel that we hadn't, made progress. But I hope that you will continue to, please continue to reach out to us. And on the next slide, if there's anything that you would like to comment on in the last few minutes, please do. I know month to month it's been a quiet group, but either through the chat box or just you're unmuted, I think, or will be. So we'd love any thoughts or final comments. Okay, so I would just like to thank all of you for your hard work to transform and improve person and family engagement for your children with asthma and their families. I congratulate you and keep up the good work. Please feel free at any point beyond the life of our learning network to reach out to me if there's anything that I can do or connect you with others. I'd be happy to do that. I'd like to thank Liza Greenberg, who has been just an awesome facilitator for this initiative, and for all of you who have stepped up as innovators and shared your learnings, challenges and successes, and to Jacinta, who keeps us all organized here on our webinars, has done a great job. So please remember, we have all of the resources are posted and will continue to be there. Liza, I'll turn it back to you if you want to share about where the information is now.
Great, and thank you, Ruth, so much for this learning series. It's been a tremendous opportunity to address asthma, and for those of you who are connected with colleagues, either at the clinical level or through your PTN coaching activity, all of the webinar series and the resources we've discussed are posted on our website at pcpcc.org/TCPI. And we encourage you to review the webinars or just go and get the resources because we think they'll be tremendous in your own quality improvement activities. And on behalf of PCPCC, I'd like to say thanks for everyone for joining, and we will close out now.